Reclaim your mobility and live pain-free. Imagine waking up each morning without the dread of stiff, aching joints holding you back from enjoying life's simple pleasures. Gardening, walking with loved ones, or even opening a jar without pain. For the 30 million older Americans living with arthritis, this vision can become reality with the right strategies. Arthritis, the leading chronic condition in adults over 65, doesn't have to define your life. This guide offers a detailed, evidence-based plan to manage symptoms, boost mobility, and reclaim your independence, empowering you to thrive despite arthritis. Why arthritis matters. Arthritis, particularly osteoarthritis, wear and tear, and rheumatoid arthritis, autoimmune, causes joint pain, stiffness, and inflammation, impacting 50% of adults aged 65 plus in the U.S. Left unmanaged, it increases fall risk, limits daily activities, and can lead to depression or reduced independence. The good news? Proactive management can significantly improve your quality of life. Below are the most effective, practical solutions with detailed steps and considerations for older adults. Solutions for managing arthritis. 1. Regular low-impact exercise. Why it works. Exercise strengthens muscles supporting joints, improves flexibility, and reduces stiffness, directly addressing arthritis symptoms. Studies show 150 minutes of weekly low-impact activity can reduce pain by up to 40%. Detailed steps. Choose activities. Opt for swimming, water aerobics, walking, tai chi, or chair yoga. These minimize joint stress while improving range of motion. For example, tai chi reduces fall risk by 20% in older adults. Schedule. Aim for 30 minutes, 5 days a week. Split into 10 to 15-minute sessions if needed to avoid fatigue. Warm up and cool down. Start with 5 minutes of gentle stretching to prevent injury. End with similar stretches to reduce stiffness. Resources. Join programs like the Arthritis Foundation's Walk with Ease, available at community centers or online. Many are free or low cost. Precautions. Consult a doctor or physical therapist before starting, especially if you have severe joint damage. Avoid high-impact activities like jogging. Tip. Use supportive shoes with good cushioning. Track progress with a journal to stay motivated. 2. Weight management. Why it works. Excess weight increases pressure on weight-bearing joints, knees, hips, worsening pain. Losing 5 to 10% of body weight can reduce knee arthritis pain by up to 50%. Detailed steps. Diet plan. Adopt a Mediterranean diet with anti-inflammatory foods. Fruits, berries, vegetables, leafy greens, lean proteins, fish, poultry, whole grains, and healthy fats, olive oil, walnuts. Limit processed foods, sugars, and saturated fats. Portion control. Use smaller plates to manage portions. Aim for 1,500 to 1,800 calories daily, adjusted for age and activity level. Professional support. Work with a registered dietitian. Medicare may cover visits for chronic conditions. Apps like MyPlate can track intake. Precautions. Avoid extreme diets, which can cause muscle loss or nutrient deficiencies in older adults. Stay hydrated to support joint lubrication. Tip. Set realistic goals, e.g., 1 to 2 pounds per month. Pair with exercise for best results. 3. Medications and pain relief. Why it works. Medications reduce inflammation and pain, improving daily function. Proper use can enhance mobility and quality of life. Detailed steps. Over-the-counter options. Use NSAIDs, ibuprofen, naproxen, or acetaminophen for mild pain. Follow dosing instructions, e.g., ibuprofen 200 to 400 milligrams every 6 to 8 hours, max 3,200 milligrams per day. Prescription medications. For rheumatoid arthritis, doctors may prescribe DMARDs, e.g., methotrexate, or biologics. For severe osteoarthritis, corticosteroid injections can provide relief for weeks. Topical treatments. Apply capsaicin cream or NSAID gels, e.g., diclofenac, to affected joints for localized relief. Precautions: older adults are at higher risk for side effects, e.g., stomach bleeding from NSAIDs, liver issues from acetaminophen. Always consult a doctor, especially if taking other medications. Tip: use a pill organizer to track doses. Discuss long-term use with a rheumatologist to minimize risks. 4. Physical and occupational therapy. Why it works. Therapy strengthens joints, improves function, and teaches adaptive techniques, reducing fall risk by up to 30%. Detailed steps. Physical therapy. Work with a therapist for a personalized plan, including exercises to strengthen muscles, e.g., quadriceps for knee arthritis, and improve balance. Sessions may include ultrasound or electrical stimulation for pain relief. Occupational therapy. Learn to use assistive devices, e.g., canes, raise toilet seats, and modify tasks, e.g., button hooks for dressing. Access. Medicare Part B often covers therapy if medically necessary. Sessions typically last 30 to 60 minutes, 1 to 3 times weekly. Precautions. Ensure therapists are licensed and experienced with arthritis patients. Continue home exercises as prescribed. Tip: ask for a home exercise plan to maintain progress. Community centers may offer group therapy classes. Precautions. Monitor for signs of depression, e.g., loss of interest, oversleeping. Seek help early. Tip: schedule regular social interactions to maintain emotional health. 9. Regular medical checkups. Why it works. Early detection of arthritis progression allows timely adjustments to treatment, preventing complications. Detailed steps. Frequency. Visit a primary care provider or rheumatologist annually or as symptoms change. Tests. Expect joint exams, blood tests for rheumatoid arthritis markers, or X-rays/MRIs to monitor joint damage. Precautions. Keep a symptom diary, pain levels, flare-up triggers, to share with your doctor. Tip: ask about Medicare-covered screenings or clinical trials for new treatments. 10. Alternative therapies. Why it works. Complementary approaches like acupuncture or massage may reduce pain for some, though evidence is mixed. Detailed steps. Acupuncture involves needle insertion at specific points. Studies show modest pain relief for osteoarthritis. Sessions last 30 to 60 minutes. Massage. Gentle massage can relax muscles and reduce stiffness. Avoid deep tissue massage on inflamed joints. Mindfulness. Practice meditation or guided imagery, 10 to 20 minutes daily, to manage pain perception. Apps like Calm offer free trials. Precautions. Use licensed practitioners. Avoid if you have skin sensitivities or certain medical conditions, e.g., bleeding disorders. Tip: start with one session to assess comfort. Combine with other strategies for best results. Key considerations. Tailoring to needs. Older adults may have comorbidities, e.g., diabetes, heart disease, so coordinate with healthcare providers to avoid treatment conflicts. Accessibility. Many solutions are low-cost or covered by Medicare, e.g., therapy, checkups. Community centers offer free exercise programs. Holistic approach. Combining exercise, diet, and therapy yields the best outcomes. Consistency is key. Fall prevention. Arthritis increases fall risk. Prioritize balance exercises and home safety. Conclusion. Take control today. Arthritis doesn't have to limit your life. By integrating these evidence-based strategies, exercise, weight management, therapy, and more, you can reduce pain, stay active, and enjoy your golden years. Start with 1 or 2 solutions like a daily walk or a warm compress and build from there. Consult your doctor to personalize this plan and connect with local resources or support groups to stay motivated. Reclaim your mobility and live life on your terms. If this video inspired you to take charge of your brain health, Give it a like and subscribe to Wisdom of Older Age for more tips to thrive as you age. Hit that bell so you never miss a video. Want to start today? Download our free brain-boosting starter guide in the description. It's packed with easy activities, recipes, and a weekly plan to keep your mind sharp. And don't forget to share this video with someone you love, because a sharp mind is a gift we all deserve. 5. Heat and cold therapy. Why it works. Heat relaxes muscles and lubricates joints. Cold reduces swelling and numbs pain. Both are low-cost and effective. Detailed steps. Heat therapy. Apply a warm compress, heating pad, or warm towel for 15 to 20 minutes to stiff joints, especially in the morning. Warm baths or paraffin wax dips are also effective. Cold therapy. Use an ice pack, wrapped in a cloth, for 10 to 15 minutes on swollen or painful joints, especially after activity. Alternating therapy. For acute flare-ups, alternate heat and cold every 10 minutes for optimal relief. Precautions. Avoid extreme temperatures to prevent burns or frostbite, especially if sensation is reduced, common in older adults. Tip: keep reusable gel packs in the freezer or use a microwavable heating pad for convenience. 6. Dietary and supplement support. Why it works. Anti-inflammatory foods and certain supplements may reduce symptoms, though evidence varies. Detailed steps. Anti-inflammatory diet. Focus on omega-3 rich foods. Salmon, mackerel, flax seeds, antioxidants, berries, spinach, and turmeric contains curcumin, a natural anti-inflammatory. Avoid processed carbs and red meat. Supplements. Glucosamine and chondroitin may help some with osteoarthritis. 1,500 milligrams per day glucosamine, 1,200 milligrams per day chondroitin. Fish oil, 1 to 2 g/day omega-3s, may reduce inflammation. Precautions. Supplements can interact with medications, e.g., fish oil with blood thinners. Consult a doctor before starting. Tip: get nutrients from food first. Supplements are secondary. A dietitian can tailor a plan. 7. Assistive devices and home modifications. Why it works. Devices and modifications reduce joint strain and fall risk, preserving independence. Detailed steps. Devices. Use canes, walkers, or knee braces for mobility. Ergonomic tools, e.g., jar openers, long-handled shoehorns, ease daily tasks. Home modifications. Install grab bars in bathrooms, remove loose rugs, add stair handrails, and use raised chairs or toilet seats. Access. Occupational therapists can assess homes. Medicare or local programs may subsidize costs. Precautions. Ensure devices fit properly, e.g., cane height adjusted to wrist level. Test modifications for stability. Tip: check community resources, e.g., area agencies on aging, for free or low-cost modifications. 8. Mental health and social support. Why it works. Chronic pain increases depression risk. 15% of older adults with arthritis report it. Social support improves coping and reduces isolation. Detailed steps. Support groups. Join arthritis foundation groups or local senior center programs for peer support and tips. Online forums are available for homebound individuals. Counseling. Seek cognitive behavioral therapy, CBT, to manage pain-related stress. Medicare may cover mental health visits. Social activities. Engage in hobbies, volunteer, or join community classes to stay connected.